It's been called an invisible crisis. KITV4's Kristen Concilio reports why mental illness here in the islands is now at its peak, and the number of people experiencing mental health issues is only expected to grow.
The uncertainty of COVID, the economy, and now global turmoil is putting a strain on the mental health and well-being of many Hawaii residents. And many of those reaching out for help can't get mental health care, at least not right away.
There's been so much trauma that people have endured, and now we have these unknowns. The need is so great right now that it would be difficult for any provider to really meet that need.
Any after effects in the morning, the earlier you take it, the earlier that would wear off.
Yeah.
According to the Hawaii Pacific Basin Area Health Education Center, the state's short hundreds of mental health providers. And many of those here aren't taking new patients or are backlogged. Some new patients are often waiting months, putting them at increased risk.
Anxiety and depression are, the most common mental health problems, and they have dangers associated with them, certainly. I mean, quality of life, relationships suffer, and then, the worst of all is that people can start to think about hurting themselves.
Mental health advocates advise people waiting to get help to do things to remain healthy, including exercising and meditating to reduce stress. They also recommend reconnecting with friends and family and focusing on self-care. Make a crisis plan, who you're going to call and what activities you can jump into right away when you feel you're at your limit. Calling the Hawaii Cares hotline to talk to a trained professional can also help you cope with your crisis. Kristen Concilio, KITV4 Island News.